Concepts that I saw in Florence Nightingale's work include spirituality, sanitation, and progressive healing. At a young age, Nightingale was super involved in the church and found her religious views by studying and reading about a variety of religions. She eventually came to the realization that her purpose in life was to serve God and that nursing was her calling. She turned down marriages to focus on her service to God, but did not believe she could be married and also do God's will of healing others. She summarized nursing for women as a calling, God's work, service to God, and relief of man. Another concept found in Nightingale's work is sanitation. This concept was found during the Crimean War. Nightingale was called upon to help treat and actually heal the injured soldiers. Nightingale experienced the horrific scenes of battle and war and formed her views on disease and her commitment to an environmental approach to health and illness. According to Nightingale, hygiene was the central element in healthcare, without which medicine and surgery would be ineffective. In order to prevent further disease and infection, Nightingale and a group of nurses encouraged soldiers to eat, focused on cleanliness, order, feeding, clean bed linen, clean bodies, and clean wards, all of which were essential to recovery. A third concept found in Nightingale's work is progressive healing, or using a holistic approach to treat. According to Nightingale, nursing was both an art and a science, and the patient is at the center of the model. Nightingale focused on each person as a whole rather than only treating their disease. There are 5 environmental components essential to an individual's health, according to Florence. They include clean air, pure water, efficient drainage, cleanliness, and light. A nurse can best assist their patient by meeting their needs and putting the patient in the best condition possible for the nature to act upon and heal. There were 3 significant contributions that Nightingale provided to modern nursing that I found include sanitary in practice, therapeutic communication, and caring for the patient, and the laws of nursing. Nightingale has shown how important being sanitary is in the hospital to decrease and prevent further infections, which has paved the way for sanitarian practices used today in hospitals, such as disinfecting equipment and hand hygiene especially. The lack of hygiene, specifically hand hygiene, and lack of cleanliness remains a leading cause of hospital-acquired infections today. Proper hygiene in the hospital can substantially decrease infections, leading to lower healthcare costs and decrease hospital stays for patients. There are numerous infection control practices and evidence-based practices that came from Nightingale's work. Nightingale showed therapeutic communication by making her rounds each night on her patients, the injured soldiers, during war. She would talk to them, offer them company, empathy, and compassion. Her legacy of caring and the activism it implies is carried on in nursing today. She extended beyond the individual patient, beyond the individual person, which is seen a lot in practice today as nurses go above and beyond for their patients every day. Nightingale's concept of spirituality and religion are also used in current nursing practice today by accepting patients' spiritual needs and providing an environment according to their spiritual needs, as well as having a chaplain available in hospitals at any time. This can allow the patient to feel safe and comfortable during their time at the hospital, which may be a scary time for many patients. Through her education, research, observations, and experience, Nightingale identified her own laws of nursing, also referred to as the laws of nature or health, which has formed the foundation of nursing practice today and guided nurses and future nurses in nursing education. In my clinical experiences, I use aesthetic knowing when I communicate with my patients. I always find ways to connect with my patients by asking about their interests or where they're from, how their day is, and asking further questions to learn as much as I can during the day. The conversation usually go on, and the patient and I learn a lot about each other. These types of conversations can help the patient forget about their pain for a little bit, might be a distraction, or even help them forget that they're in the hospital for a little bit. These conversations can improve a patient's mood as well. If I can help make my patient's day or improve their mood by having a 15-minute conversation or walk in the room with a smile, I always will. I experience aesthetic knowing at least once during each clinical day that I have. A non-empirical pattern of knowing can be key in understanding a patient's needs or to improve a patient outcome, because the nurse can recognize what the patient needs at that moment in order to help the patient feel comfortable, safe, or feel better in that specific situation. Using social cues and knowledge, nurses can understand what their patient may need and either use communication or actions to help their patient. How does Nightingale's work and patterns of knowing inform the work of nurses today? Patterns of knowing can help us know how to communicate better with our patients. It can identify our strengths and weaknesses when it comes to communication. We can recognize areas we need to improve on in our interpersonal and communication skills with patients, family members, colleagues, and even providers. Nightingale's philosophy on nursing and our environment forms the basis of nursing practice today, as we are now very strict on infection control and hygiene in and out of the hospital. Also, hospitals accept and allow several types of religion and spiritualities in the hospital. We follow strict sanitary guidelines to prevent infection and also use a holistic approach as well as evidence-based approaches while treating and healing the patients.